Hello everyone. Welcome to Time Chat. I'm your host, Dr. Yvonne Khan. The New York Times recently wrote an article titled The Moral Bucket List, which I was lucky enough to read. The Times piece started by mentioning how every now and then we run across a person who radiates an inner light. These people can be in any walk of life. They seem deeply good, they listen well, they make you feel funny and valued. You often catch them looking after other people, and as they do, so their laugh is musical and their manner is infused with gratitude. They are not thinking about what wonderful work they're doing. They are not thinking about themselves at all. When I meet such a person, it brightens my whole day, end quote. When I read this back in the April 11th issue of the New York Times, I couldn't help but just think of one or two people whose spirit embodied the sentiment. The first was my late father, Dr. Mansour Khan, and the other person who I instantly thought of is today's guest, Dr. Ilora Rafique, MD and PH, and founder at Nirvana Integrative Medicine. Dr. Rafique grew up as a lifelong New Yorker in Jamaica, Queens. After completing high school at the Mary Louise Academy, she received her undergraduate degree from New York University. After NYU, Dr. Rafique spent her next 4 years obtaining her medical doctorate from SUNY Downstate Medical Center. Upon graduation in 1997 from SUNY Downstate Medical Center in Brooklyn, where she received her medical doctorate, Dr. Rafique began a career dedicated to underserved communities, with dignity and cultural sensitivity to diverse communities throughout Manhattan, Queens, Brooklyn, Bronx, and Westchester. In the year 2000, she completed her residency program in internal medicine with a specialized focus in the biopsychosocial model in the Bronx at Montefiore Medical Center. To enhance her ability to advocate for her patients and her profession, Dr. Rafique completed a master's in public health from Columbia University, focusing on health policy and management. During the past decade, she managed a large hospital-based practice group at Montefiore Medical Group, serving as the medical director with intention to improve the primary care experience. Her experience as a caregiver, supporting with her mother's illness with breast cancer, fueled an interest in holistic approaches and was determined to expand it to primary care. Dr. Rafique has been accepted to the University of Arizona Integrative Medicine Fellowship with access to the nation's experts in the field. Nirvana Integrative Medicine is deeply rooted in its commitment to provide a healing space where a patient's full potential for wellness can be enlightened and empowered. In addition to leading her holistic medicine practice to new heights, Dr. Rafique spends much of her free time serving her community in other ways. In addition to being an advocate for breast cancer awareness and prevention, she serves at SUPNA NYC, a Bronx-based South Asian women's empowerment organization. As the Times piece concluded, this type of service, love for others, decenters the self. It reminds you that your true riches are in another. Most of all, this love electrifies. It puts you in a state of need and makes it delightful to serve what you love. Without further ado, I introduce a personal mentor for me, Dr. Ilora Rafique. Dr. Rafique, thank you so much for joining us in Time Chat.
Oh, this is such an honor. Thank you so much. It's always a pleasure having some time with you, Ivan.
Well, we have a chance to work together on so many different types of things.
Yes.
How's life been for you and what's new in your busy world?
It's been great. I have actually been celebrating a whole year of surviving breast cancer personally. Has been my goal for advocating for this cause through SUPNA NYC, which is a very near and dear nonprofit here in New York. Been very blessed because yesterday was our big Susan G. Komen luncheon, where some of the work of our nonprofit in reaching those South Asian women were honored. In fact, was talked about right on stage by Nancy Brinker, how the efforts in the Bronx from our small organization is allowed women from South Asian countries who've never ever had a mammogram to really have that experience of being able to advocate for themselves and empower themselves by getting access to much necessary care. So for me, it was a huge dream fulfilled, and I was very proud to represent our group.
Well, we're so excited for you, for the team at SUPNA and all of your patients, I'm sure. Since we're on this topic, if you can speak a little bit about the benefits of early mammograms. I know that there's different types of evidence out there for different groups and depends on socioeconomic status and race and a whole bunch of other factors. So what's that magic number our community should be start thinking about mammograms?
It is a very controversial topic. In fact, there's a lot of debate now on current guidelines. Maybe, as we know, the governor's very close loved one, his girlfriend of many years, Miss Sandra Lee, who underwent surgery. Maybe the politics and the policy might change. There are a lot of guidelines that have conflicts, mostly because when we've screened women early, we're taking a little bit of the balance of the risks of the radiation versus screening something early and catching something at an early stage, which is always the goal. Early detection is the cure.
Early detection.
However, I think if you definitely have a family history known, as I did, I had started screening very early as my doctors had recommended.
Got it.
In the late 30s, maybe at least a baseline if you have a family history. If you don't have a family history, most of us will encourage a woman to start at 40, but not annually at 40, every other year. There's a lot of debate about that 40 to 50 age group, but definitely guidelines all confirm that after 50, a mammogram annually is recommended. So it really is a personal conversation with your doctor, most often to really look at your risks entirely.
Yeah.
Sometimes people don't realize that a primary relative can also be an aunt, a grandmother. It's not just your mother.
So aunts and grandmothers count in family
Yes.
history, and they recommend mid to late 30s for those with strong family history.
But something that I actually had posted today in reference to the genomics, what we're learning more about cancer, which is really near and dear to both of us, is that cancer genetics may be the real answer to our solutions, because we are sometimes creating these large guidelines for a large population, not knowing individually what precisely that person really needs. So that's the new strategy, is precision medicine. And precision medicine is guided by genetic strategy based on genetic markers, but a lot of those are not yet, we have to have large pools of people that we can do research on, especially in the South Asian community. Today, actually, they were talking about how a large population of the Polish community, which Nancy Salerno, who guides the Susan G. Komen program, has advocated for research, because sometimes we are realizing there are other breast cancer genes, not just BRCA1 and BRCA2.
Got it.
There are two, BRCA1 and BRCA2. Which is probably most famous through Angelina Jolie's personal, editorial to the Times about 2 years ago, when she, really shared with the world. But for South Asian women, we need really a more enhanced research tool. We need to figure out if we can collect data, and that's what they've been doing with a lot of other populations.
I'm going to pause right there, because most of our viewers at home, getting to see your doctor, that's a blessing.
Absolutely.
So if you're even navigating, if you're facing a diagnosis like this, how do they get that genetic test to see if they're a best candidate for that treatment? Before we go on to some of the other work.
Yes. Well, what I'm talking about is probably a future strategy. Right now, if you're considering, if, for example, my mother had a very early stage breast cancer, she was 32 and I was 42. So if you have that kind of a risk in your family, you should seek the counsel of a breast surgeon, as well as a primary care doctor, and discuss that, because you may be a candidate to at least test for the known genes. The only known genes right now are BRCA1 and BRCA2. But what I'm suggesting is that perhaps there are other South Asian genes. We just haven't studied our population enough. And I think we can really get more details from that. And
we're going to be able to touch on this in a little bit, but I want to start with you focus on your practice at Nirvana.
Thank you.
You've had a chance to be all over the city and go into undergrad in NYU, but you trained during your residency in the Bronx.
Yes.
And you're from the north, and your practice is based up there. What's it like serving the Bronx community and being a part of that community?
The Bronx is really the most diverse community. It's been really exciting being a part of the Bronx, because there's a large Latin population, the Hispanic, but also majority of are a lot of Irish, a lot of Jewish patients that are older that have been there. It's a retiring community. They've remained in the Bronx for years. Some have moved away, and then we have a large influx of people actually from Bangladesh, and so it's a really quite just a blessing to serve people where they are. But it's a large immigrant population. We have a lot of African patients now. very close to Pelham Parkway and Jacoby and Montefiore Hospital, where I'm affiliated. So it's really, you get to see the world. And I think that's been my experience of being a physician in New York City. It's quite a blessing.
So, thank gosh we have, great practitioners like you, and we have a Bangladeshi community that's very, very, long established in the Parkchester, Castle Hill area for at least 15, 20 years. But now there are new immigrants up in the 205 section and a lot of Bangladeshi immigrants in the Yankee Stadium area. Are you able to see as many Bangladeshi patients as you may want, or how is the diversity in your practice?
As I was at Montefiore for many years, I was able to see more near Norwood and 205th. Right now, in the Pelham Parkway section, I think, there are definitely people that have sought me. But I think local is local, so I think a lot of times I'm reaching out to find those patients, but through my advocacy through SAPNA and some of the other works. But I'm always happy to see new Bangladeshi patients. So I think the large group of them, though, were very close to where my original office was.
Great.
And a lot of them do follow me.
And as you know, there's disparities in both healthcare and education, and a lot of that we do see in the Bronx.
Yes.
And we're going to touch on that a little bit after. We're joined with Dr. Ilora Rafique, the founder of Nirvana Integrative Medicine. We'll be right back with her after these messages. Welcome back, everyone. I'm Dr. Ivan Khan, the host of Time Chat. We're joined today by Dr. Ilora Rafique. So, Dr. Rafique, we had a chance to hear about your work in the Bronx serving your patients and a lot of your work around breast cancer awareness and prevention. I'm sure a lot of people want to know that we have a lot of younger viewers at home, a lot of young women and a lot of young men, and a lot of parents who would love to see their children in the medical field or even public health. And you're all over from New York. You're from Queens, and I get to tout that as a proud Queens resident myself. So why did you choose medicine? Why did you choose public health? There's so many different ways to give back. What was it about these fields that took you into that?
I think, particularly being someone who is surrounded by healthcare growing up, my father chose a profession where he served the community, and I believe that I've carried on some of his personal work. Choosing to serve is really a very personal and ideal goal, but I agree with you. You can serve in many different ways, so I often encourage young people to keep their options very broad. As there are so many ways to get involved, to serve your community. However, being a physician is such an ultimate privilege, to be able to be in the space with the patient, to witness their pain, to help to guide their decisions, because I feel at some point we are kind of more meant to be a partnership rather than some of the old models of practicing, which I think need to be kind of looked at. It's not really patriarchal, right? It's more of let's have a conversation. Let's
a
find
joint decision almost.
Correct. So I think in general that's been a big issue in my life, is keeping the patient really at the center of everything. And definitely being 12 and having my mother diagnosed with breast cancer, I really felt that a profession of being in medicine was really the right place for me. And
you've had a chance to, you went to some great institutions. You went to NYU for college. You went to SUNY Downstate and got to serve there for medical school. Tell us about your academic life. What was that like for you?
Oh, it was really a great experience. I think New York City is just really the center of the world. I think that, I've really been blessed with that kind of experience growing up in Queens, finding myself really surrounded by a very strong, warm personality of the community that I serve, because they all encouraged me. I was very much the youngest young adult. And, when I decided to go into medicine, I had all these fans from our community. And when I went to NYU, to undergraduate, it was really a great experience still to be close enough to home, but to experience the city in a different way.
Right.
Medical school was really a great opportunity in Brooklyn.
Okay.
Brooklyn, I actually say it all the time. My brother lives in Brooklyn now because it's hot. But I said I lived in Brooklyn before it was so exciting.
That's right.
And, areas that are underserved, I really witnessed firsthand. First in Queens, in Jamaica, Queens, and South Jamaica, Mary Immaculate Hospitalist.
That's right.
I used to be a little bit of a student, and I would shadow a lot of doctors. So I went through the process of figuring out, is this something I want to do? I volunteered with a local doctor as well in Queens, Dr. Aguilar, who's still in practice on Wexford. He's a pediatric doc, and he said, sure, come after school and, shadow me. So I really encouraged that. And then being in Brooklyn and seeing different ethnic communities and being able to experience community health outreach through programs like HIV/AIDS awareness, because at the time that I went to medical school, it was a big AIDS epidemic.
That's right.
So I was really at the height of really being able to see a lot of different illness.
So having been in this amazing time in medicine in our city when infectious disease was through HIV/AIDS, it was getting so much publicity. You took your training up in the Bronx, and then during your training in internal medicine, you worked and focused on the biopsychosocial aspects of medicine.
Yes.
And that led to your founding Nirvana Integrative Medicine, which is a more holistic approach. Why the biopsychosocial? If you can explain to viewers at home why that, and how that is incorporated into your holistic approach, and how that's different from the traditional sense of medicine.
Oh, absolutely. Yes, people get very confused. They wonder if I'm, a socialist from Cuba when they see that I was in the social medicine program. But the social medicine program is a unique program. And basically what it involves is that a doctor should have that understanding of not just the biology of the disease, the emotional resilience of the patient, and the socioeconomic factors that contribute to disease. So those determinants all have a place to play in how someone handles health and wellness. So in my training, that was really essential, and it carried through to many aspects of why I developed Nirvana.
Okay.
And Nirvana in practice is really something where I felt I needed to have more control in how the patient experience was, rather than be involved in a hospital setting where those things were dictated to me. I was able to create that environment where maybe I would have mental health available, where I would use other modalities that would help support a patient's healing, such as acupuncture for pain relief, looking into other herbal remedies. I had a great interest in that, so.
And how is, you've been able to practice that and also take advantage of it as a patient? And
oh, yes.
So
yes.
if you want to share a little bit about if folks are facing any type of illness, how much should they look into some of these alternatives to traditional medicine?
Sure. Part of it, really came from my experience with my mother passing. When her illness became at its late stage, I found that traditional medicine really didn't offer much, and it really kind of failed the patient, which I think you can agree on, that there's we have a wonderful profession. We can offer the biggest drugs and the largest imaging, the CTs, MRIs, when a person is dying and when a person needs just comfort care. Our medical profession really hasn't had the nuances. So I really got interested in palliative care as well as integrative health, and a lot of integrative techniques are used mostly for cancer patients. That's where it's become very much a part of a lot of cancer treatments, because a lot of those other modalities don't have as many side effects as their traditional chemo.
That's right.
It helps to offset all those excess side effects and symptoms that really drain the energy of the patient. And then emotionally, patient really requires the support of someone who's caring and there to listen. And not all doctors are trained that way. We are trained, unfortunately, to hold a great amount of knowledge in our head, like a sponge. But to sit and hear the patient talk.
The bedside manner, as they say. Right?
They say, it's a good 7 minutes into the conversation and the doctor steps in and doesn't really let the patient speak. So hearing and listening to someone and understanding how to handle that is also a very important technique. So in my training, we did a lot of motivational interviewing. We really learned a psychosocial approach through actually mental health professionals.
Okay.
So when we did our precepting, we would, see the patient, prepare our case, and discuss it with a doctor. But we would also discuss it with a mental health professional who would give us a different angle. Well, have you asked them about do they have a sick child? Are they taking care of an autistic child at home?
Right.
Maybe they have other stressors that are contributing to their asthma.
Yeah.
Maybe it's emotional. Maybe it's anxiety. Always keeping the full understanding of what a patient experiences is really important. And for me personally, that was true as well. Last year I had a bilateral mastectomy and reconstruction, similar surgery that Angelina Jolie had taken in efforts to not only prevent further disease, but to also treat stage 1 breast cancer. And in the course of me deciding what kind of treatment I would want, as a conversation with my doctors, because it is a partnership, I told them I would want also some acupuncture for pain management. I needed to have Reiki therapy and massage for some of my post-surgical pain, because I did not want as much narcotics.
Yeah.
And I really found that it allowed me to really heal faster. And having that ability to do yoga and breath work and some of the energy work that keeps the energy flowing in the body, which is another important aspect that we don't think about. So energy medicine is a huge field as well.
Wow.
So last year I was very happy to, even after my surgery was over and my personal healing was done, it had been a long-term goal of mine to become board certified in integrative holistic medicine, which I did complete in San Diego.
Congratulations.
Thank you. Thanks so much.
That's amazing. So you're taking your own life experiences, this time from the patient side.
Absolutely.
And using that to gain your expertise and even go as far as becoming board certified, which is extremely, extremely difficult for any subspecialty or any field in medicine.
Well, this is, I think, becoming the norm in the West Coast and other countries. Actually, Prince Charles in the UK has a huge integrative trust. So they're really looking at other options, homeopathy, some of our other modalities, Ayurveda. These have been thousands and thousands of years. So for us to begin the process of really learning the ancient traditions, we need to go backwards to really heal the future of patients.
We definitely want to get to know more about you at home a little bit, but before we go to the line of questioning, we have a lot of, new moms, new dads, and youngsters at home. And is there anything that you would advise around women's health and prevention for all the aunties and sisters and bhabis and appas at home around women's health?
Yes, I think the woman always has, sometimes they're the center of the home. Everyone really looks to us to have just really knowledge and, care and concern and food and nurturing. But I think, us as women, we always tend to nurture ourselves last. So what I would advise a lot to the aunties and appas at home, as early as you can, try to schedule time to make an appointment with your doctor. Make sure your health is first and foremost, because if you don't take care of yourself, you won't be there for your family, God forbid, if anything should happen. But I think a yearly exam is very important, because we have a large risk in our population of diabetes. We should also talk to our doctors about our nutrition. Maybe it's something that they can also, the minute the woman in the family changes the diet, the whole family really improves their health. So I think if we can encourage women to have these conversations, and also very important, which we've noticed through some of our work in SAPNA, is that, in addition to access to breast screening, a lot of younger women haven't really gone for their PAPs and their GYN or gynecologic exams, and it's very important for us, especially in a lot of our women in our community have wonderful pregnancies and babies, and they go to the OB. But after the baby making is finished, they forget about taking care of their own health. So please make an appointment with your GYN as well as your primary care doctor.
It's really proven early OB/GYN exams. It's really proven to reduce mortality in a lot of cancers.
Absolutely, and there are many issues sometimes that you don't feel comfortable about talking with a male doctor. There are many female physicians and as well as gynecologists, but I do think that's very urgent.
Absolutely.
So.
Before we get going for today, we want to make sure that we have time for a few questions. One question around work-life balance. You're a wonderful mother of two beautiful sons, and you have an amazing husband that I have the honor of knowing as well. How do you balance all of your medical practices to your not-for-profit work while being a mom and a wife at home?
It's been quite a juggle, and it is a balance. I have to create some priorities. Obviously, my children are my priority. However, I think they've also grown up in this atmosphere, just like I did, that my parents served. They served others, they served the community. So I think there's also sometimes quality time versus quantity. So I think if what's important to me is obviously spending time with my children, it has to be good quality time, not just quantity, because I want them to know, and I think they also really they're proud to see me involved in so many activities. They learn what it is to serve others. I'm hoping that they will become those kind of role models for their family and friends. So I think having a mother that's outside the home is not a bad thing. And I'm also very blessed, as you know, my husband is very supportive of my work. Without that, I think it would be impossible. So I think I have to give a lot of credit to my husband. He's very open-minded. He understands that I have a bigger purpose in life, and he's accepted that.
Amazing. It's such an honor for me to have you on our show, and we can't wait to have you back in a few weeks or a few months when you're available next. Thank you so much, Dr. Rafique,
thank you so much,
can't wait
Ivan.
to have you back.
Thank you.
We just had a chance to speak with Dr. Ilora Rafique, MD, MPH, and founder at Nirvana Integrative Medicine. Dr. Rafique's life and career is one that I've followed closely since my final year at SUNY Downstate Medical School. Not only was she an MD, MPH, but she dedicated herself to humanitarian causes long before I had a chance to get to know her. One of the big reasons that I was so thrilled when she said yes to being on Time Chat is her willingness to give the most valuable thing that we all hold dear, our time. Despite having a very successful career, a beautiful family with 2 kids and a great husband, Dr. Rafique chose to spend a big portion of her free time exploring new ways to give back to her communities. Those communities expand a wide range of socioeconomic groups, various healthcare professions, and various ethnicities as well. Dr. Rafique isn't only focused on giving back to her own communities, but any neighboring one that may be in need of her support and time. Being involved in education and the South Asian community myself, I urge all of our viewers at home to follow in some of her footsteps. Even if all of us don't become clinical physicians, Dr. Rafique's involvement in various not-for-profits, charities, and other ways to give back is a shining example of how powerful the New York City South Asian community can continue to become. As we conclude today, I urge our viewers at home to think about a cause that's dear to you and get involved. Even if 1 hour of your time every week can make a huge difference in someone's life, that is all worth it. Thank you for watching Time Chat. I'm your host, Dr. Ivan Khan. I hope to see you next week, and until then, pay it forward.